Thank you so much for staying with us on AIT, and this is People, Politics and Power. We do sincerely apologize for that long break. It was due to some technical difficulties which hopefully we have overcome. And our focus today is on the health sector in Nigeria. Now, by now you are aware that health workers in Nigerian hospitals are on strike. The strike commenced at 12 midnight on Sunday, and it will last for 7 days. It's been described by the unions as a warning strike. Now, the unions are very much here with me in the studio, the leadership of the unions, as to say. First, from my immediate left is Mr. Comrade Bio Belemoye Josiah. Is the national chairman of the Joint Health Unions of Nigeria, Joint Health Workers Union of Nigeria, and President Medical and Health Workers Union of Nigeria. Thank you so much, Comrade.
It's a pleasure, sir.
Also joining us is Dr. Obinna Ogbonna, Vice Chairman, JOHESU, and President, Nigeria Union of Allied Health Professionals. Dr. Ogbonna, thank you so much for joining us.
Thank you for having me.
We're also joined by Abdurafiu Adeniji, National President, National Association of Nurses and Midwives. Thank you so much.
Thank you. It's a pleasure joining you.
Join us. Right. Well, so, Comrade Josiah, of course, this is not your first time here in this studio and talking about these same issues. But this time around, you are here because your unions, the Joint Health Workers Union that you head, is effectively on strike at this point in time. Beginning from midnight on Sunday, it has been your comrades, your workers, your colleagues have been on strike. Now, tell us why you have decided to go on the strike this time, against the backdrop of the fact that Nigeria, like many other countries, is facing the pandemic, the COVID-19 pandemic. And against the backdrop, too, of the fact that you have been holding a number of conciliation meetings with government. What went wrong?
Thank you so much, and good day, Nigerians. First, I want to apologize to the teeming populace of Nigeria for what is happening now. I sympathize with our loved ones. But I want to also say that what happened? Why now? It's a matter of people in a system being treated appropriately, and then people treated with trust. This is not these issues we are talking about, they are not very new. Apart from the COVID-19 issue, every other issue has been a protracted one. Some have lingered since 2014, and we have been very, very patient with the government. If you recall, our last strike is 2 years. Since 2 years, we have not gone on strike.
2018.
2018. We have not gone on strike. And even within the COVID period, the provocation was there. But we felt at the height of the COVID surge, we should not try to compound the situation. We should not try to compound the situation. Nigerians, we have love for Nigerians, and we are patriotic people. So we allowed patriotism and love for Nigerians to override our pains. But unfortunately, the government seemed to say that, look, your patriotism, your patience, your patriotism is stupidity, your patience is cowardice. And they kept, refusing to attend to these issues that we have peacefully been presenting to them. One of the top issues is this. By July 1st, we had a meeting in the Federal Ministry of Health, and that meeting resulted into agreeing to correct the errors of the COVID-19 inducement and hazard allowances. And we were requested to give the 24 hours to submit list of those who have been short paid and omitted. And we did what they asked us to do, which was a very difficult task, but within 24 hours. Even though we told them that each time you ask us to do something, the next you come around to say, oh, unions ought not to have done it. It's not the responsibility of unions. They said, no, this time is different. We did it. But from then to Thursday when we met, they never told us that these submissions we made were not in the right, that we are not the rightful people to have made those submissions.
Even when you raise that issue ab initio?
Yes, we did that. That marks the highest level of insincerity. And again, before I let you go to maybe other person and other issues, remember we gave 15 days ultimatum. A 15 days ultimatum, if the government was sincere, they would have called us from day one. Or maybe at most within 72 hours we would have been called. But they waited until 72 hours to the expiry or less, and then they decided to call us so that they will hamstring us into saying that, then blackmail us to say we are very insensitive. But I think Nigerians will understand. We have brought our own resources to even get PPEs and others for the public because of our sensitivity with the situation. We also have provided our own resources to provide PPEs when PPEs were lacking to our members, to protect our members. And then, for anyone to look at our own, and again, you are all witnesses, for those who went on strike, all their issues, almost all their issues, 6/8, as they announced. The government claimed that they have solved 6/8. So we that are patient, they told us that patient dogs don't eat fat bones these days, that patient dogs get no bone to eat anymore.
Dr. Bona, the reports we are getting from across Nigeria at the moment indicates that your members, JOHESU members, have actually gone on strike from Ibadan to Kano to Lagos to Benin and across the country. Yeah. The hospitals are grounded. And this is not a situation that anyone will be happy with. We are still in the COVID pandemic era. Yes, your union and your members have been patient, so to say. Could this have been held back a little bit longer for the situation to ease?
Well, in physics, there is always a time you stretch an object and you get to the breaking point. Any further stretch at that time, that object will really span and break. I think like the chairman said, we have been on these issues for many years. And if not now, when? A good example of what had echoed our demands in the past is the issue of infrastructural decay. If not for the COVID that has come and made our leaders not to jet out for medical attention, I don't think anybody would have looked at those issues seriously now. Like he said, it was during our meeting on Thursday that we are informed that 126 billion had been earmarked towards addressing the trouble. Why has that not been released before now? That's a general outlook of what is happening. On to our members who are direct victims, because we are service care providers. If the service care providers are not provided for, then how do you think the efficiency of their delivery will be? We don't want to go there exposing our members unnecessarily. Over more than 1,000 plus counting of our members now have been exposed and infected. No PPE is available. Then, more importantly, our welfare issues. It's when you are alive and well taken care of that you'll be able to take care of others. So like the chairman said, other issues like our withheld salaries, the adjusted conhests that are supposed to be like a motivator. It was even disclosed openly to us on the 10th of March, 2020, that the adjusted core has approval that Mr. President would have given assent to was not taken to him directly, but it was stored at the SGF's office, and we were told lies that Mr. President said, no, there's no money, when Mr. President did not see it. These people are not representing Mr. President very well. We call on Nigerians that there is no better time than now for all of us to tell the leaders of the nation that there is need to focus on the health sector. Health is wealth, and our well-being, psychologically, financially, and otherwise, is very key to effective healthcare service delivery to our members. So this is the right time, because we have waited. And we don't know when next or who next will be a victim. For how long? So many of our members have even died waiting without some of these their agreements. And somebody said our strike is illegal. Look at, on the 28th of March 2020, the National Industrial Court of Nigeria gave a judgment to the government that is favorable to us, that the government should go ahead and implement within 4 weeks. Up to this moment, those issues have not yet been implemented. It was on that Thursday meeting that they said, okay, give us time, let us look at it. How long are we going to continue to wait? So when anybody is saying it is not time, it is not time. When will be the time? When are we sure that COVID will be over? COVID has come to stay with us. We'll just try. Those of us who are the health care workers are the same persons, by the special grace of God, that God will use as foot soldiers to defeat the COVID. But morally, or if we are not motivated, where will be the morale to fight the COVID-19?
Mr. Adeniji, he just talked about what the government said last Thursday. 126 billion naira appears to have been appropriated by government to address the issue of structural and infrastructural decay, which is one of the issues that you have always talked about. Now, as operatives in the health sector, have you seen evidence of this 126 billion on ground in any of the health facilities?
Thank you so much. We are yet to see any impact or actual demonstration of the release of this 126 billion. And the question to be asked is, who is deceiving who? Why must the federal government wait until Thursday meeting before we are informed of the release of 126 billion? Where are the evidences? And what can we show for it? Not even any of the hospitals in Nigeria can reflect this issue of release of fund. When we go to most of the health facilities we have in Nigeria, we don't need anybody to tell us how the depth of the infrastructural decay. Nurses, pharmacists, lab scientists, from every area they are performing, are already tired of even improvising some of these facilities. For how many times have we shown to Nigeria how nurses take delivery with the torchlight of their phone? For how many times have we shown that even the refrigerator in the pharmacy sector, in the pharmacy section, are not working? For how many times have we gotten to the hospital and there is no power supply in the hospital? There is no water supply in the hospital. We are talking about this, and we are talking about many more. Because when we are talking about infrastructure and structural decay, you can even see that in Nigeria here, JOHESU was at time raising alarm in Federal Medical Center Owerri, where they purported to have carried out a project. The project was not on ground. Up to today, those of us that raises alarm are still under punishment of the Federal Ministry of Health and the Federal Government of Nigeria. The most dangerous trend is the fact that the people that are expected to even present these cases to government are just deceiving themselves. Not until Thursday evening that we knew that the president is not aware of all these things that they are saying, that we presented your case to the federal government, the president said there's no money. when you come into the real thing that is happening in the health sector, it is a case of maladministration. With the little resources we have, people are not being sincere. Because health sector is a multidisciplinary sector. Everybody who is involved is expected to perform his or her own role. The infrastructural decay that they are talking about, how many of the people who are professionals are carried along to even ascertain we are the one who cry foul that these things are not there. But if you want to implement these things, those who have cried out knows where it pinches. As we are talking about the COVID-19 issues, most of the hospital does not have monitor to say that a nurse is coming to observe a patient who is in critical stage of COVID-19. There are no monitors to demonstrate the health status of this patient until when that nurse goes to the bedside, take the pulse physically and like the way we have been taking it, exposing the health workers. And this is what is accounting for increasing number of people, our people, that is coming down with COVID-19 positive test. Many people have died also. The issue we are talking about is the issue of not only the health workers. We are trying to preventing much hazard to the Nigerian citizens. Because if you do not do it, nobody can do it. We are the one that is there, and we must know where this thing pinches. The situation that is on ground is that health workers are just being made guinea pig, being pushed to the lion's den, and no person cares about. If you say we have spent tens of billions of naira during this COVID-19, and the people that are working, the little stipend you are to pay them, you are not paying them. A lot of these health workers are missed out. Many nurses were not even included in the payment. So as a result, just like my colleague said, the extension limit has been reached, the breaking point attained, and therefore it is not easy for any leader to curtail health workers not to demonstrate their franchise. And the issue of whether it is legal or non-legal, we have served the legally 15 days ultimatum to the government.
Now,
and anybody that is
the argument of government here is that health workers cannot go on strike during period of emergencies. That's health workers who are on essential services cannot go on strike during emergencies, and it is counter to the provisions of the ILO Convention and also the Trade Dispute Act 2004.
Well, we should ask a question: who is to be blamed? The ILO Convention does not say that people on essential duties cannot go on strike. Give 15 days ultimatum to alert your employer. And what the employer is expected to have done, that first day, second day, 72 hours after a receipt of this TDN, the Trade Dispute Notice, they're supposed to have constitute a meeting, not waiting to the penultimate night for this ultimatum to expire. Equally, when we are talking about the Trade Dispute Act and then the ILO Convention, the right to strike is the right of the workers. And this is to press home, because it was the last option to call the attention of government, who should have acted proactively to prevent this situation. If they have not done what they are expected to do, you can only be there. On Thursday that they said we met, the labor were there as from 2 p.m. The government side were not prepared until around 4:30, 5 p.m. And we had meetings for 6 hours. Nothing was coming out. They were just playing around the issues. No single thing was agreed upon at that table. And in any dispute declared, when you take an issue, we reach an agreement on it. But on this case, there was no agreement. And that was why no agreement was signed by the two parties.
All right. Comrade, I need you to come in here, because government is now saying that JOHESU is trying to arm-twist the government. In fact, is throwing it back at you and saying that you are trying to intimidate the federal government into doing what, of course, you had not agreed on at the Thursday meeting. Now, you were supposed to have gone back to the extended NEC meeting and report back within 48 hours to government. And It appears your report back is the decision to go on this strike.
Thank you once again. And first, if government claims that we are trying to untwist government, then the question should be asked, was government sincere on that day when they came to the table? The opening speech of the conciliator was a threat. We have placed our grievances to you 15 days, in fact, not just 15 days, months before. And then we gave the official notice, the trade dispute notice, the ultimatum, 15 days back. And we come to the table rather than say, oh, Labour, we have received your message. Sorry, we did not get down to you early, but that we believe we can find a solution to this matter. The first thing was to flash so-called ILO provisions and the trade dispute provisions. And first, let me also tell Nigerians, the ILO provisions are not things that you just pick and choose. Every day they talk about ILO convention. Have they also met the barest minimum wage, the decent work status that ILO has also prescribed? Have they done that? They have not done that. Now, they came to say we tried to untwist them. We never untwisted them. We gave them enough time to go into this matter for us to resolve these issues. But they always have been doing everything with dishonesty. And I am not afraid that without any apologies from anyone, they displayed a high level, gross dishonesty. One, these are people who told us that they said, okay, yes, we have seen that there was error in the implementation rather than what was contained in paragraph 1A of the agreement, that they do anybody earning 5,000, the 5,000 should be replaced with 50% of his basic salary. And that they have mistakenly, in error, paid some persons 10%, that they would be ready to correct that. And they did not say anything on that. Thursday, they said, okay, issue a circular, or make sure Minister of Health issue a circular to ensure that the correction is completed, and then so that pay can be made by Tuesday or so. But behind that circular, after issuing that circular, they now followed up with a text message to CMDs and MDs that please exclude accounts and admin personnel. And this is one of the sub points of the of the dispute.
That was not contained in the circular.
In the circular. It wasn't contained in the circular. And we have got information now. The June money is being paid now. And actually, the 10%, that's without correction, they are now releasing the money.
So it's still the 10% and not the 50%?
Not the 50%. So that is a level of hypocrisy and dishonesty that they have taken to that table. By threatening us that, we have no work, no pay. And we are waiting. The last thing, always, whenever JOHESU goes on strike, after waiting painstakingly, we know that their last port of call is hiring a mercenary NGO to take us to court. It's only JOHESU they have ever taken to court. They have arraigned only JOHESU in court. The last time we were in court, and the court never found it plausible to sentence us, so we are freed. And we also know that the same people who are talking about violation, they have violated court judgments many times in our favor. Court judgments in our favor, just like my vice pointed out. The ADR we went to, they hired NGO to take us to court, and then the matter was referred to ADR. We spent so much time in the ADR.
That's alternative dispute
resolution. Yeah. Then we spent so much time, longer than necessary. We came back, and then we had the consent judgment. 28th of March, 2019. 2019. And this consent judgment ought to have been fully implemented within 4 weeks, maximum. What is today? More than a year after. Has it been implemented? No. The current adjustment that is also a part of our major dispute. We signed an agreement 2017, 30th September. We signed an agreement. And the government accepted that it will implement, that's the processing and implementation will take 5 weeks. And today, 3 years after, has it been done? The issue, my brother President, the MNI, mentioned about Owerri. They invited Nigerians, the government invited Nigerians that we should blow whistle, fight corruption. And we also believe that the decay in the system, much of it is also contributed by the corruption in the system. Whereas underfunding is a major issue, we believe that without the level of corruption in the Federal Ministry of Health, that Nigerians would have gotten better health services, even with the meager one we are getting. So we felt fighting corruption is a basic tool that we feel if we can achieve that, then we now increase the funding, then we can be closer to our El Dorado. So we pushed for that. And our members blew genuine whistles, for which the anti-graft agencies came into it, investigated, and also found preferred 18 count charges, meaning that our whistle was genuine. Were we supposed to be punished for that? But as I speak, because the Federal Ministry of Health at that point in time wanted to do a cover-up. So we resisted the cover-up by ordering a strike. Where you said you have spent over 100 plus million to build the project, and then at the site of the project, no grass, no strand of grass had been removed. And you want to cover up. And you want to impose that same person to victimize our members. So we embarked on a strike to alert government, to alert the highest power of government, the president, to come in and see what is happening. For that reason, our members in FMC Owerri were even denied promotion. They were denied months of salaries. And then the same Federal Ministry of Health used it as a bargaining chip to say all those who want to, initially over 1,000 persons were denied salaries because they participated in JOHESU strike and supported the anti-corruption. Now they now use it as a bargain chip. If you want to stay with JOHESU, your salary will not be given to you, your promotion will be lost. But if you want to come on the other side, then you get salaries, your salaries paid, and then promotions restored. And about 300 persons, gradually over 300 persons now crossed over. Now we still have about 700 plus that are still saying Nigeria is our nation. We are patriotic. We will rather stay without the salary until who ought to hear this will hear it. So these are some of the things, and these are some of the unpaid salaries we're asking for.
Okay. All right. Dr. Ogbonna, let me go back to the issue of allowances and hazard allowances and inducement. Now, the federal government is saying it has spent 20 billion naira in payment of April and May 2020 allowances, and about 8.9 billion for June 2020 COVID-19 hazard and inducement allowances. And he says this is for all categories of health workers.
Yeah. Well, we don't have the papers. We only see figures. It is when those figures are translated into money in the pockets of members that the claims will have veracity. As we speak with you now, he has said it. Some of the members are calling us now. That humongous amount that have been earmarked for such, members are calling that instead of the 50%, they are receiving only 10%. Where do we go from here? It is not what is written in the paper that matters to members. It is what is in their pockets. So do the right thing. Let me also say this. When you talk about illegality, you don't also untwist labor. On the 30th of September 2017, there was a CBA, collectively bargained agreement, the labor and the government, they got that agreement, not under duress. And government promised labor that they were going to do the adjustment cohorts within 5 weeks. And the process started. And the Salaries and Wages and Income Commission, we are commissioned to do the needful. And they arrived at the calculation and tabulation, and they got a figure that 22.6 billion would be adequate to do the needful so that there will be peace. And that process started, and it was stalled without getting to Mr. President, who has perpetrated illegality between the labor and the government. When you continue to, these things are not recent issues. They are agreements that have been signed. When government will not be sincere in implementing the agreement, why will labor not use our own power too? You cannot beat a child and say the child should not cry. So whenever we are crying, the government will say we are trying to twist them. But when the labor cries, nobody wants to listen to labor. Nigerians, please help us appeal to the government to do the needful. It is not in our pleasure to withdraw services because we are not used to withdrawing services like others. He has mentioned it. For about 2 years now, we have been waiting patiently. Why not use that period at that time to have resolved all of this issue? Why should we get to this level and be blackmailed that we are being insensitive? Who is more insensitive in the matters of the health workers? Is it the government or the workers?
Mr. Adeniji, one of the other issues that is in dispute or that we put on the table at this meeting was the issue of understaffing and irregular employment in the health sector. Tell us more about that.
A healthy nation is a wealthy nation, and the measurement of healthiness is how many professionals are actually working. In Nigeria, Nigeria has an aging workforce in health sector. Apart from this, we have suffered unemployment and issue of migration to where people are being valued more. This created a very critical situation of critical shortage of manpower, especially in the skilled manpower area. And it is affecting the safety, the quality standard of our healthcare services, and even the safety and the treatment outcome of the patient in the hospital. This is so critical. Take, for example, when we choose nursing. According to the WHO standard, there are supposed to be about 800,000 nurses in Nigeria to serve about 200 million population, taking the ratio of 40 to 100,000 population. But as we are talking in Nigeria today, we have been training nurses for even the Western world to employ. And this is creating a very drastic shortage. Today we have just about 6 nurses for 100,000 Nigerian population. This is the population at large. When we even come to critical areas like the COVID-19 thing we are talking of, they are supposed to be adequately trained people. They are not there. The way it affected nurses is the way it affected pharmacists, the lab scientists, the physiotherapists. And this is very, very serious. We raised the issue. And if it was part of what we have been deliberating upon. But instead for government, Federal Ministry of Health to do what it's expected to do, even when they agree to form a critical care committee to look into the shortage of manpower and how to make replacement, they are just going from one place to the other, employing in an haphazard manner. This is not solving the problem at all. And by our calculation, in the next 3 years, more than 30% of adequately trained health personnel will be retiring. In the next 7 years, almost 60% of these adequately trained people are going to retire. This portends a very great danger, not only for the people that are working and suffering burnout and stress. Many people are dying out of all this stress, and to make it worse, there's no health insurance. The death benefit of our people are not being paid. Of recent is just when the House of House of Representative on Insurance and Actuary Services called a meeting. The federal government is found wanting in the area of implementing health insurance for these people. So apart from the shortage of manpower, the morale of the people that are on ground is demoralized. There are no motivated workforce. So it's creating a great work for us. This little time that COVID-19 did not allow the highly placed people to travel out, they are now trying to do a pseudo attempt to that. So this shortage of manpower is very, very drastic. There are no adequate number of people, and adequate staffing is what can save life. Adequate staffing is what will lead to quality healthcare services. WHO in 2001 says there are about very fundamental things about healthcare. It must be accessible, it must be affordable, it must be at the right time when the people need it, it must be at the area where those people are living, knowing fully well that Nigeria will live, most of the people are living in the rural area. It must also be safe. It is not just pretending that you are attending to people. It will make a guinea pig of human being, and will be sacrificing a whole lot. That is why our maternal mortality is so high in Nigeria today. And most importantly, those measures that will have brought this thing down are those things like even employment. See the midwife service scheme that was put in place sometimes ago, about 5 years ago. It reduces the maternal mortality of Nigeria to the BRS minimum. But the money that is expected to be used to sustain this thing was messed up. The MDG could not sustain again. The state government were not contributing. Local government was nowhere. And then our maternal mortality is soaring up again. It has soared up. And many people, it's even worse for somebody to attempt to give birth in Nigeria than to say you want to give birth in some third world war-torn countries.
All right. Dr. Ogbonna, let me come to you before I come to the president for a final shot.
Right.
Yes.
Yeah.
I need you to sum up here.
Okay. Well, we are appealing to our teeming populace to really understand with us. We are not callous. We are not unmindful of the stress and the troubles that the withdrawal of service will cause them, because our workforce, we are about 95% of the health workforce in all of the federal health institutions. And this is not a threat if the government does not do the needful. We, as leaders, are just obedient servants. Our principals that are members, they are still waiting. And they said this is just warning strike, that government should not allow the members to say, okay, we want to go indefinite. It's a doable thing. It is not out of reach for government to do the needful, because there are perennial issues that adequate money had been provided for in the past towards solving all of these issues.
The problem is, where did all that money go?
You got
Comrade Josiah, now this is a warning strike, 7-day warning strike. Yeah. Assuming within the next 7 days, government does not respond in an appropriate manner to your demands, what will happen thereafter?
Certainly, we are very organized people and we respect the rules. So we will invite the NEC back to reappraise government's reaction and all that. And then the NEC will take a decision. And I do know, even at this point, after the threat on that day of the meeting, the NEC wanted to say we should just forget about warning and go straight into indefinite. But as a people who believe in saying what we say, or doing what we say, or saying what we do, we said we have already notified that it is 7 days warning strike. So they should please permit we, the leaders, to still stand by that. And so the expectation is that if government thinks that by spreading the story of, or the rumor of, oh, it's an illegal act, it's an illegal strike, will solve the problem, will intimidate us, it will never, never intimidate us. I still repeat, if it amounts to us as leaders going to jail for fighting for the rights of our own member and for the good of the health services of this country, we will take that sacrifice. And I want to state clearly, very clearly, that I will not regret if I'm sent to jail for that purpose. I will only regret if I'm sent to jail because I pillaged the country's wealth, as is being done. But if I'm protecting the wealth, I'm protecting services, I'm protecting the health of the people, I'll be the happiest man. On a final note, let me state clearly, sir. One issue they are bandying about, trying to convince people that, the admin and accounts are not clinical, therefore they shouldn't have been paid equally. I tell you, in the hospital services, we are all health workers first. Health workers. It's just like in the army. The driver in the army is a soldier, is it not? The security in the university is a university staff. That's why when he goes there, you don't pay him on the comps. You pay him on the university salary structure. So, for one to say these people are not part of us, the accountants are the ones that receive revenue, money from the patients, and issue receipts. The administrators also interact with the patients when they go to the wards to take records, and then they are within us. They are within us. And of the over 1,000 persons that have been infected today, administrators are part of it. Accountants are part of it. Cleaners are part of it. Laundry people are part of it. The security are part of it. Who sees the patient first? Is Dr. ZZ in the hospital? Is he in the hospital? Who is he asking at the gate?
The gate man. All right. Comrade, on a final note, supposing the government invokes the no work, no pay policy, as it did previously, what would be the response of JOHESU and your members?
Well, members have said, because this no work, no pay itself has been selectively implemented, it has never been implemented against anyone except JOHESU members. Recently, you also are aware about 2 strikes within this COVID period has come and gone. Nobody has been punished with no work, no pay. So, Nigerians should ask the question, why the apartheid in the health system?
All right, let's leave it at that and hope that those who are in government are watching and listening, and that the health workers are very critical to our healthcare system in Nigeria, where if government was able to persuade the resident doctors to return to work last week after 1 or 2 days strike, government should be able to sit down with the Joint Health Workers Union and resolve the issues. They are not insurmountable. They are issues that can be resolved and resolved adequately. I want to thank you immensely for coming on. Comrade Biobelemoye Josiah is the national chairman, JOHESU, that's the Joint Health Unions or Joint Health Workers Union of Nigeria, and President Medical and Health Workers Union of Nigeria. Thank you so much.
Thank you.
Dr. Obinna Ogbonna is Vice Chairman, JOHESU, and President, Nigeria Union of Allied Health Professionals. Thank you for your time.
Thank you for having me.
And Comrade Abdurafiu Adeniji is the National President, National Association of Nurses and Midwives. Thank you for your time.
Thank you. It's a pleasure.
All right, and for you, our viewers there, we want to thank you immensely for investing your time with us. And we'll see you again on Monday when we bring you a fresh edition. On Friday, I beg your pardon, when we bring you a fresh edition of People, Politics, and Power. Until then, bye for now.